Assalamu alaikum. You're listening to Radio Ramadan on 87.7 FM. I'm your host. We're talking about community and what makes a community. And in particular, in this case, we're talking about what makes the NHS community the biggest family in the world, the NHS is. And we've got a very special guest come into the studio. We're broadcasting live from Evington Road. And it's a very colder day than yesterday, that's for sure. And I think most people are probably having their food at this moment in time and praying their namaz, but please keep the radio on, and if you've got any questions, please call in with any questions you might have. Our guest is Carter Singh Beering, who's the head of chaplaincy at Leicester Hospitals, and he's been there for a good few years. Welcome to the show, Carter.
Thank you so much, Zafar. It's an absolute pleasure to be here on Ramadan Radio, to be speaking out to all of our communities and listeners out there, all of my Muslim brothers and sisters. But also it's an opportunity for us as people of different faiths and beliefs to come together and talk about all that connects us, all that we do in our city of Leicester, in working together, living together, and striking and striving to thrive together. It's an opportunity to do all of that. And like you said, the NHS is probably the biggest employer in the country. It connects so many people, but also it connects with so many families. You know, there is no part of our country that doesn't have some connection with the NHS, and there'll be families dotted all around from around the world who will know about the NHS and the care that's provided, free at the point of use, there without fear or favour, accessible to everyone. And I think that is probably a really powerful place to start, because when we think about health is one of the greatest wealths that we have, and maybe during the month of Ramadan, as brothers and sisters are fasting and contemplating on what it means to be without food, you may also think of those in need, those who are suffering, those who are ill in health, and imagine the challenges that they face, and maybe feel grateful for all that God has blessed us with, all that we have.
And it's sort of certainly Ramadan is a spiritual moment. The month of the year that we actually think about everything, and particularly people who are ill in hospitals. And you're in the chaplaincy service. How did you end up as being part of the chaplaincy service? It's not an ordinary thing that most people do. And what made you really focus on the NHS as well?
Well, I think there's...
And are you a Leicester lad as well? That was the other question I've obviously got for you.
Well, Zafar, I would be delighted to say I'm a born and bred Leicester-Farian.
Fantastic.
Born and bred in this city. I've lived my life here. I love this city. I love what it has, what it stands for, the vibrance of it, and I'm proud to be a part of Leicester and celebrate all that Leicester has. And I'm of the view, every time I meet someone who talks down their own city and their own town, I think, hold on. You know, maybe we think about what Kennedy says, ask not what your country can do for you, ask what you can do for your country. And I would say, let's ask ourselves, well, what can we do to make our city better, our community better, and take personal responsibility for it?
And that's the real sort of background to this, because, you know, I'm Leicester born and bred, and I think because you're so passionate about what you do, you will go the extra mile. I mean, to come into the radio station, to talk about what you do in the hospitals and how you actually help people, help patients, and help the staff deal with all the trauma that they go through as well. Which schools did you go to? Did you go locally, and which colleges?
Oh, I went to Lyndon, then Judge Meadow, then Beecham, then the University of Leicester, then I went to De Montfort after that, then I went back again and did my Masters after that at De Montfort again. So I'm a proper Leicester lad, you know. Wow,
that is really proper Leicester in every sense of the word. So you know what the makeup of this community is. Because regardless of whatever religion you come from, Leicester is the most important binding factor with lots of people who live here, work here, and end up staying here for the rest of their lives.
Absolutely. I've lived in this city. I have made friends across all communities. I have journeyed with people. I've seen people through struggles of deprivation, of challenge, of discrimination, but I've also seen the great highs of people succeeding, people breaking barriers, you know, breaking glass ceilings. I mean, we're sitting here in Evington, and I can't not in this moment recognise someone who we lost very recently. You know, Councillor Manjula Sood, who was an absolute star of working with other communities and working across borders.
And I can tell you, every single show, she gets a mention.
And she
gets a mention because the humanitarian in her, above politics, above everything else, true Leicester, caring about everybody, regardless of background, regardless of religion, always there to help.
Yeah, absolutely. And again, there's something in that about how we build our city, how we build the communities. For me, again, it's Ramadan. For many of our listeners here, their faith is central to their life. For me, my faith is central to my life. And I begin with Iqwa on God. There is one divine that is a source of all existence. And therefore, you and I are all connected. We are connected with the world around us. So how can I look with eyes of judgment and say, you are lesser or other than me? We are all part of that same fabric.
And you work at the hospitals. Do you think the hospital reflects the sort of Leicester demographics and background? Because, Leicester, we care about our city, and we care about what happens, and we care about. And do you think that transpires in the hospital? Because they deliver excellent care most of the time. Lots of people come back to me. The feedback I get is, we were in hospital, they couldn't look after us any better.
Absolutely. I think that our hospitals are a microcosm of our society. We have staff from all of our different communities. We have that many different religions and cultures and nationalities and languages amongst our staff population. They represent and reflect on the communities of our city and county and beyond. And so there is a direct connection between those two worlds. Equally, there is lots of efforts that are put in to strive to be better at being inclusive, to be more welcoming, to be the best we can possibly be for all of our communities. And that isn't just about one size fits all, it's about tailoring. Now, if I bring that back to the chaplaincy service, Leicester was one of the first to employ diverse chaplains, so Hindu, Sikh and Muslim chaplains as part of the Christian chaplaincy team. The Leicester hospitals went one step further. We were the first in the country to employ a non-religious chaplain, a chaplain who is from a non-religious background. Again, it was about, we are the NHS, we're here to serve our communities. It's not good enough for me to simply serve who I think we should serve. It is about the public and making sure that we access and provide support to them.
But I think that is more to do with the management and the way they looked outwardly and thought, hang on, there's lots of people from different religions coming into our hospitals. How can we make the environment the best possible environment for them? And what can we do to change that? And I think they actively did that. And hence, you're head of the chaplaincy service. But I certainly know during COVID, it was a tough time because people couldn't even go into hospital. And I know, there was these cubes that were placed, Qurans, lots of things. You were involved in some of that. What was happening?
There was a lot of innovation that took place. Again, necessity is the mother of all invention. You have opportunities. When things happen, it is how do we respond in a way that serves our patients, our staff community. And there were innovations that were put in place. The Quran cubes are a great example of that. And to give it a real example, here is something that was introduced during the pandemic. Yesterday in hospital, I went with my Muslim colleague because we were dropping that Quran cube off to a patient, an elderly gentleman who was at end of life, who unfortunately has passed away. But again, for that family, for the prayers to be heard as someone is journeying towards the end of life, during the month of Ramadan, it just adds that layer of care. It's not just about caring for people, it's making people feel cared for. And if you feel cared for, it's a huge difference.
And mashallah, that's a fantastic thing that you do, really. And if you think about it, to go that extra mile, which Leicester hospitals do. And I've seen this on several occasions. And there's cubes. Who are they paid for by? Who's buying them? Is it volunteer? Is it donations, or are you actually? Do you have the money to purchase them as the NHS?
So a lot of, again, we have to recognise that the public purse is spent with great responsibility, and it's not something that is ever taken lightly. The trust has financial responsibilities to the taxpayer, to the public. And so there are lots of things that the trust provides. There are also things that hospital charity supports. Those are additional things. On top of that, there are things that people through donations that we can contribute towards. The Quran Cubes is one of those things where people in the community have given generously and enabled those things to be provided. And I thank wholeheartedly those members of our community who in their generosity have given. And as my Muslim chaplain will say to me, the blessings that will be received by the person whose name we will never know, who donated
Did
those
that.
things, who contributed to those things, will go with them.
Yeah,
Absolutely.
forever.
Absolutely.
Forever, literally. You're listening to Radio Ramadan on 87.7 FM. Our phone number for the studio is 0116 48222086, or you can send us a text or WhatsApp message on 077 488 55055. You're listening to Radio Ramadan on 87.7 FM. I'm just going to give a plug to another show that I'm doing on Sunday morning, which will be from 11 o'clock till 12 o'clock in the morning. And we're going to be talking about shisha, vaping, smoking. We'll have the top consultant from Leicester Hospitals in, Dr. Sanjay Agarwala, and he's a leading expert in the field of smoking cessation and shisha and the damage it causes. And we'll be having an open, honest, frank discussion about these real issues that are affecting our communities in Leicester. Carter, you very sort of passionate about what you do at the hospitals. You're the head of chaplaincy. What does your day entail? As you said earlier, you went with a Muslim colleague and went and did dropped off a cube to a patient who was dying, and sadly they have passed away. Does that happen on a regular? Is that what you do when you're in hospital most of the time?
So there is no day that's the same, and every day depends on two things. One is we have the structures of what we do as a service. I, as the head of service, have lots of responsibilities to make sure that service runs well, to make sure that we're striving in so many areas to improve the performance, the care, the delivery. All of those aspects come into that, making sure that we're working to standards. But equally, on the ground, it is supporting patients. It goes back to that person-centered care. It's about the patient, it's about the family, it's about the community, it's about the staff. We are caring for people, and people are at the heart of everything that we do. Chaplaincy, the way that we operate, is a relational model. We have that relationship and that support and the care that we provide alongside all of the excellent medical interventions that will be provided by the trust. It's providing that holistic care. So no day is the same, and some days are tragic. I was called into the children's intensive care yesterday for a young child who had unfortunately passed away. And for those listening, many people can't even conceive the pain that someone might feel to lose a child and how much of an impact that might have on someone's life. That, again, is one part of my day. There may be times when I'm supporting staff and working with staff. And I'll give you a sense of the team and service, because that might give you a sense of perspective. Because if you really understand the UHL, it's a huge operation.
18,000 people work there.
18,000 people work there. 260,000 people attend A&E in a year. I think we have 1.4 million people coming in throughout the year, patients. That's a huge number. That's a huge volume of interactions. But again, our service has consistently been growing over the last few years. Since the pandemic, consistently, if I look at our statistics, they've grown. And if I just quote some stats to you, again, these are actual live stats that don't include Q4, the fourth quarter of our year. And year on year, at this point in time, from April last year to January, we've visited around 13,000 patients. We will have that number will go up because it will then conclude this last quarter. We've had over 2,200 referrals. That's people requesting support for our services. We have almost an out-of-hours urgent call every day, almost in a month, 30 call-outs on average. So you can imagine our service is 24/7. Day to day, we will provide support to patients, to staff, but in an emergency, there is always someone at the end of that phone who may come in to support. Just before I came here, I was with a Hindu family, and they were requesting Bhagavad Gita, which I gave to them. And I said to them, if you need a Hindu chaplain, day or night, in an emergency because mum is dying, you can call the chaplaincy service. You can speak to staff. They will contact us, and that person, there's always someone at the end of that phone. And so for us, it is recognizing care isn't just from 9 to 5. The hospitals work 24 hours a day, 7 days a week, and it's about caring for people. And all of that is about caring for the person, because every person there is a relative or someone out
Somebody else there, yeah. And sometimes actually, when you notice somebody might be on their own, they might end up in Leicester by default and might end up in the hospitals by default, and they might be on their own. do you offer that support to them and say, look, this person's got nobody, how can I help you?
So there are lots of ways that we interact with patients and across the board, across all of our hospitals. And two different ways I'll talk about our service. It's a wonderful descriptor. On one side, we're like nurses. We're regularly, consistently visiting patients on the wards, sometimes through referrals, sometimes through visits. And again, when we visit a patient, we get their consent so that we can engage them in a conversation. Again, we come with no agenda. No chaplain is evangelizing, proselytizing. We are there to serve the person in front of us because every patient is vulnerable. The second thing is we're paramedics. When there's an emergency, some crisis, something urgent, there's a chaplain who's able to go there very quickly and provide the care that is needed and the support. Because again, for many of our communities, at those crunch moments when life and death meet, it's so important that we get those moments right and we care for people in a way that acknowledges the whole person. And that may include faith and belief.
And lots of people, when sadly, when somebody is a relative that's going to pass away, they want to be there. And sometimes in a room or in a ward, that's not obviously appropriate. But I think they're much more flexible than the hospitals have ever been from recent sort of talking to lots of people recently.
So again, there are two aspects to that. One is a ward is a clinical environment, and therefore the ward staff want to help every person as well as possible, but they have to balance out every person's need. And so they'll often try to be as accommodating as possible to enable family to be there with someone at those crunch times, at those points of time when, someone is end of life or someone is being withdrawn from treatment. Those moments, they may be able to enable that. The staff makes every effort to enable that to happen. And again, I recognise our communities will often, at those moments, there'll be a lot of people who will be there at the bedside or want to be there by the bedside. Now, it's not always possible to have 30 people around a bed in a bay, but the ward staff will work with people to try and find a way to navigate and manage that. And I've had it where we've had a large number of family members, more than can be accommodated at one time with the patient. When it came to doing last rites and prayers, the ward facilitated enabled every person to be there for those very important sacred moments.
I don't think that happens at every hospital. I've got to be honest with you. I think Leicester is unique in that, and it's so good to see, actually, not only the hospital reaching out to all communities that it represents, but actually making a difference, making a real difference. Absolutely. By having people like you there.
And I think this is a credit to the NHS for providing high quality chaplaincy services in our NHS as a part of the provision that they offer. Again, it's a credit to the University Hospitals of Leicester, who are incredibly supportive of the chaplaincy service, who, again, there are so many teams and services that we work hand in glove with for our patient's outcome, for the best possible care and outcome for that patient, because every patient matters.
And we're in the holy month of Ramadan. What's happening in the hospitals during Ramadan? So it's because I was there last week and I just happened to be there at prayer time, so I went in to do my prayers, and the staff prayer area was full.
So just to give you a sense, across 3 hospital sites we have Friday prayers that take place. We also have around 300 religious services that take place across all faiths and beliefs in a year. Again, significant volume of services on top of all the patient visiting, the staff support, all of those aspects. Now, during the month of Ramadan, I'll go through different aspects of it. In our hospitals, we have dedicated space where people can go and pray. There is space where people can offer that time. And again, we recognise Ramadan is a particular month where members of staff will want to do extra prayers. In their breaks, they may come into the prayers and just read the Quran because it is important in those times. Yeah. We have that. We have Friday prayers. We also, in the hospitals, have in the prayer rooms, dates and water. Because for our Muslim members of staff or members of the public who are there, who are going to break their fast, we want to have something. And again, thank you to the charities, One Nation and others who've supported us in enabling us for us to provide that. As a chaplaincy service, we hosted an iftar event at the Royal Infirmary for our staff community. It's not something we can do every day, but it was my Muslim chaplain. He said to me, he goes, I'd love for us to do something. And I thought to myself, well, it's not just your Ramadan, it's our Ramadan. Yes. And so for me, it's a sense of seva. How can we serve another community in what's important and valuable to them? And so we have that in place. We have then with our staff. Now, we work with management and staff to find ways of providing reasonable adjustments to enable people to pray during their work time. Again, it's based on clinical need. Now, I would imagine that if a heart surgeon is in the middle of surgery and is a Muslim, they're not going to say, it's time to pray, I need to go.
No, but I think there is massive dispensation.
Yes.
For those. In Islam, they would say, actually, saving somebody's life.
And this was the point I was going to make.
Yes,
I think religiously, I think Allah would probably look back and say, actually, no, the most important thing to do right now is save this person's life. And then on top of that, if there are members of staff who want to pray, again, we work with staff. We try our best, where possible, according to clinical need, to try and be responsible and adjust towards that. In terms of food, again, for our patient population, the halal food provision is there. Again, HMC certified. Again, we listen to the communities and we've worked with the suppliers to enable that it responds to what the community is asking. And I said to my Hindu chaplain and my Muslim chaplain, when they went to the place where the food is prepared, you are the person that gives me a sense of quality assurance, so that when I speak to our communities and our leaders, I can say with confidence that I've had someone of authority look at this and give me the okay that yes, I'm satisfied, this meets the criteria. Because I don't want any one of our communities to come into the hospital, or our Muslim staff, patients, to feel I'm not sure about whether this is halal or not, and whether I'd be doing something wrong.
So just to be clear, all the food that is labelled halal HMC is proper halal food. Yeah. So anybody can eat it. I have certainly eaten the food at the hospital, some tasting sessions. And I've got to say, the food is very good quality now. I know the supplier was changed a few years ago, and lots of people have said that the actual food is really good quality over the last few years.
Well, I imagine that in this time, when we think about people who are fasting right now, you will appreciate when you break the fast and the taste of food. Go on, Zafar, you're going to say something.
I was going to say, we've got a message coming in, and somebody from the Quranic Foundation, the message is, whoever saves a life, it is as if he had saved mankind entirely. Yeah. And that is the words in the Quran, which means actually that saving somebody's life is far, far more priority than anything else at that moment in time.
And again, that message, that thought, that feeling resonates across lots of faith tradition. There will be teachings across religious tradition that recognize the sanctity of preserving and saving lives.
Well, in real terms, I mean, that's why, hospitals, they call some of the staff angels. Yeah. Because they're the angels who are there to save you. And that's across all religions, not just Islam, I'm sure.
Yeah. It is recognizing those who save life and preserve life. It is momentous, the impact that it has, because if that allows someone to have a better quality of life, every day that they live further with that better quality of life is a gift that's been given. Every person that has been close to death and has survived and continues to live on, every memory, every hug, every caring word, every encounter that they will generate from that point on forward is a gift. And I think that in itself is such an incredible thing. And that probably touches upon a topic that I think is important and relevant to our communities. It's organ donation. Yes. Organ donation is something that affects so many communities, but particularly South Asian communities are disproportionately affected. Why? Because there are not enough donors. Now, again, there are different views on this, but there are also scholarly, edicts and verdicts that are given around this that may guide people.
And the suggestion is that if you want guidance, speak to your imam, speak to your local mosques, and if you're thinking about organ donating, get some advice.
Absolutely.
I'm not an expert, and I know Carter's not an expert, but at the same time, go and get advice, because there is an opportunity to do something different.
Absolutely. And again, if you gift an organ of your body to transform someone's life, think about every blessing that you might receive from that person, the quality of life that you may give. One of the things that has been really in the focus at the moment is eyes. Yes. Imagine giving someone the gift to be able to see. Imagine how much we take that for granted. Yeah. And yet the gift of organ donation is something that is incredible, that would transform so many people's lives. But also, here's the thing. It's your uncle and your aunt and your brother and your sister who might need that organ.
Talking about organs, I'm previous to Ramzan, I was watching, I'm interested in special needs, and was watching the program Autistic Doctor, the Good Doctor. I don't know whether you've ever seen that or not.
I've come across it. My aunt says it's a fantastic show.
Yeah, so I would suggest, because you can actually feel the difference of the care and compassion, and of doctors caring for patients, and actual, because sometimes you must be supporting staff as well, because they go through trauma at certain times when they're having to deal with patients who they lose sometimes.
So within the hospitals, there are lots of support services for staff. We've got health and well-being, we've got occupational health, we've got psychological support services, again, like Amica, and we've got chaplaincy services. These are different ways that we might support our staff, because it's the mantra from the pandemic. Who cares for the carers? And I always say chaplaincy. We're one of those people that cares for the carers. And if I think about the last 3 quarters, again, statistics, 1,800 incidences of chaplaincy supporting staff.
1,800?
Yes.
Yeah,
throughout the last 3 quarters, again, because there are lots of people who need that little bit of support. And my view is, sometimes if you support someone during a time when they are in need, it may enable them to carry on caring, but also when you're at your best, you are able to care and serve others. And I think that in itself is such an important thing, because self-care is important. If we look after our own health and well-being, we are better able to serve others. What do they say about the oxygen mask? You put your mask on first so you can breathe, and then you help someone else.
Okay. We've got a message coming in. According to contemporary Hanafi, Sunni and Shia scholars, organ donation is generally considered permissible, halal, if it helps save a life, as it is viewed as a form of charity, sadaqah, and helping others. Both living and deceased donations are permitted under strict conditions, such as not selling organs, having consent, and ensuring the donor is not significantly harmed.
And I'll touch upon this because we've worked quite closely with the Organ Donation Service, and I am part of the Rotary Club of Organ Donation UK. The process is very, very considerate and respectful of the people who donate organs. Again, there are lots of strict parameters around donating those organs and how that may be done. The families view are often considered in that as well, because again, it's a sensitive topic. And I'll put my hands up and say the organ donation team is so considerate and respectful in this whole process. If someone is considering it, don't just think that it will not be treated with the utmost respect. It will be.
And it's important that we all take part in these things. Saving somebody's life, the opportunity to do that, is important. And I think more people need to think about these things. And I think as time has gone on, I think communities are becoming more and more aware. But it does need a bit more outreach and a bit more of the imams and maybe other people to speak out a little bit more. And it's a gradual process, unfortunately, rather than.
Yeah, and I think there's something about people's understanding, because again, there are so many things that you can learn in life, and there's so many topic areas. Often people only hear a soundbite, a TikTok reel, a WhatsApp message, and that's a snapshot they have of complex, complicated, but also a very thought out, considered process.
And life expectancy in Leicestershire is a lot less than certain other places in the country, particularly in Leicester City, and particularly in certain wards of Leicester, the life expectancies is quite different, quite stark, almost 10 years in some cases.
Zafar, you've said that 10 years. That was a statistic I heard by, and I thought to myself, how is it possible that in the same city that we all live in, that someone's life expectancy is 10 years less than someone else? And how do we even conceive that reality?
I use that in some of my speeches at the council, because for me that's a real big issue.
Absolutely.
How can it be that you could be living in Evington or another in Spinney Hills and have a 10-year life difference to the people living in Weston Park or in Stonygate or Knighton? Those are the figures. That's the real difference, and it needs people to understand, as we talked about health, healthy living and well-being, but also organ donation, but also looking at ourselves and thinking, what are we consuming and what are we doing and how do we need to stay healthier? But also it needs organisations like the NHS to reach out and do more.
Absolutely. And if we look at the NHS 10-year plan, prevention is better than cure is one of the key messages that's out there, because if we prevent people from becoming ill or prevent diseases from exacerbating, then actually not only do we help people and have healthy and more wholesome lives. We also prevent them from coming into the healthcare services. I look at hospitals, the Punjabi कहंदे आ कि थाना कचहरी ते hospital बंदा मजबूरी नाल ही आंदा. As in, the courts, the police station and the hospital, a person only goes there when something's gone wrong. And actually, how do we support, enable our communities to stay fit, healthy and active and out there? And I think this relates to another area of work that the Trust has really invested time and energy in and is committed to, and that's about how do we address health inequalities, because it's an issue that affects so many communities, but also there'll be particular communities that it's most impactful on. And how do we tailor our services to enable better ways of engaging with those communities so that we improve the outcomes of those who are most affected? And linked to that, so we have a Director of Health Inequalities, so Ruhani Abaratane. She is dedicated towards how do we tackle and work on this issue. We have actually our Health Equality Summit coming up. Again, it's an opportunity to focus on this as a piece of work. But also, the hospital has the Health Equality Partnership, which is about bringing community voices, people who are engaged, organisations, institutions, to help shape that community voice, because we are connected to our communities, and listening to our communities and working outreach with our communities, connecting with our communities, enables us to reach out and work towards those 10-year objectives for the NHS. Prevention is better than cure, community services, so that we enable only those who need to go to hospital to go there. Because if we think about the statistics, 260,000 people go to the A&E in a year. That's an incredible number. I don't think many people will even imagine that's how many people might turn up through those doors. But the thing is here, a lot of people may end up there because maybe they've not been dealt with in the community.
So primary care.
Or they've not gone to the right channels. There are, pharmacy services now expanding what they're offering. Your local GP services, there are ways in which you can gain that. There are things that you can just manage by yourself. It doesn't always require people to come to our doors. But here's the thing, Zafar. Any person who comes to our door will get treated. They will get cared for. We will strive to do our best for them, not just in terms of medical care, in terms of the whole person.
And I think I've experienced that firsthand, and I can honestly say that's only been the experience that I've ever had. You're listening to Radio Ramadan on 87.7 FM. If you want to call in on the telephone number, the phone line is 0116 4822 086. And you can also WhatsApp us on 077 488 55055. We're talking to Carter Singbing from Leicester Hospitals. And, we talked about the health inequalities. And you mentioned there's a Punjabi sort of saying about you don't try and go into hospital unless you really, really have to. Lots of people volunteer at the hospitals. I certainly go in and try and look at what I can do to try and help the hospitals and try and support them, because it's such an integral part of our lives. And I think we need to all be part of the NHS. And it's one huge family. It's the largest organisation in the world. It cares for millions of people. And we need to do it on our own level in our own city as well.
And I think volunteers is just another area. We have fantastic volunteer services in the hospitals. We've been going for years. We've got lots of volunteers who give their time. And I say this, volunteers are priceless. You can't quantify and give enough thanks to those people who give their time. And again, in all of our religious traditions, the idea of giving to charity isn't just about money. It is about the time and energy and effort that you expend. And so there are people who come in and give their time to support our buggy services, to support, ward-based visiting. We have chaplaincy volunteers as well who go around and just visit patients and provide that very basic human-to-human pastoral encounters. And again, it's about encouraging people. And again, one of my great drives has been, how do I encourage diverse communities to engage in volunteering? And if they're interested in chaplaincy volunteering, they can get in touch with us. And again, there's a process, there are requirements, but again, we want to encourage people to give
all
back.
The people who drive those buggies around taking elderly patients or patients around who aren't sort of capable on their feet, they're all volunteers. There's people who are inside signposting saying, look, where do you need to go? I'll help you. They're all volunteers. And you're right. I don't see enough Asians involved in that generally. We need more people to volunteer. So if people have got a few hours a week, it's not a full-time job or anything like that, but they can give a few hours of their time per week and actually donate it to a really worthy cause and really make a difference.
Absolutely. And if you go into the hospital, you will see them in the blue T-shirts with the volunteer teachers. They will stand out. You will know who they are. And if any of you said, "Hi, I'm lost," and you see one of the volunteers, pretty much every time I see it, "Where would you like to go? Let me take you there. Let's have a look. Let's see what we can do." That care is just such a gift.
And I've spoken to some of the volunteers. They love doing the job.
Absolutely.
They love doing it because it gives them something in life. It gives them that element of caring for people, helping people, and actually it gives them a buzz.
I believe the joy of giving is far greater than the joy of receiving. I would testify that in my life. I find more joy in giving and helping and serving others than necessary if someone gave me something. I'd appreciate it, but actually there's something about...
It's not quite the same.
No, and I think there's something about volunteering that is so special. And if any of our listeners out there would want to volunteer, they can get in touch with the hospital volunteer services. Again, it's in a hospital environment.
And you can find that if you just Google Leicester Hospitals volunteer services, it'll come up probably.
Yep.
Or you can contact the hospitals on the main switchboard number, volunteer services, or you can go into the hospitals and speak to one of the volunteers and say, "I would like to volunteer, who do I speak to?"
Absolutely.
So the opportunities are there to be able to volunteer in the hospital, and actually, just to have that NHS badge on your jacket to say that you're a volunteer in the NHS. I was working with the NHS for a little while, and it gave me a buzz just to have that NHS badge.
It's a thing of great pride to be a part of that institution, a caring institution that serves all of our communities.
And it's a major family.
Absolutely.
It's a family, isn't it, really?
Yeah. And top to bottom, I often joke with colleagues and members of staff, we're NHS people. Yeah, there's something about being a part of that family and community, that there is a connection that you have because we have a shared mission, and that is to serve the people that come through our doors. And again, there are lots of ways that people can support us. If people want to volunteer with us, that's a great way. But also, it's a month of giving. And people can also donate. And one of the charities that you can donate to is the Leicester Hospitals charity.
And I know Leicester Hospitals, we've come into the studio here on Evington Road, and the banners are all up.
Yeah,
Leicester Hospitals charity. What are they collecting for, and what's happening? Because I know it's a big
pledge weekend
day tomorrow.
That's right. So we have again the big pledge that's happening this year is for the Children's Intensive Care Parent Facilities. Now,
so just in case anybody doesn't know that, so the Children's Intensive Care Unit is next to Ward 14 at the Royal Infirmary on the 4th floor. And at the moment, there's no parent facility. So if your child is critically ill...
So they're limited parent facilities at the moment.
It's about one bedroom or two.
Yeah, it's expanding that. And if I would share just a reflection in that, at night we go home and we go to sleep, right? We go to our beds and you feel a sense of peace and comfort. You're in a comfortable space. Now imagine if you've got your child in hospital and you're going home to your bed. You physically may be at home. Your mind and heart is at the hospital still. And I can imagine you probably won't sleep so well because your mind and heart will be with your child. Now, in the hospital, there is a space there, but there isn't enough space for as many families as we want. We want to improve these facilities because the peace and comfort that we might give to a family member, a parent, so all you parents out there, think about it. If your child was unwell, you'd want to be with your child. You'd be worried about your child.
I've been in that scenario in my lifetime, and it's incredibly difficult.
Yeah.
It's incredibly difficult because you don't know what's going to happen next.
Absolutely.
And there's never a moment where you know when you're there as to what's going to happen. And it can happen any time at night. I have slept down there many times in the Children's Intensive Care Unit, sitting on 2 chairs and trying to sleep, then going to work the next day.
Yeah.
And also, I've also slept in the side room as well a couple of times. And, sometimes the nurse will come and wake you up and say, things aren't looking too good. And it's really difficult not to be there.
Yeah.
And it's really difficult to be there as well.
Yeah.
But at the same time, if we can make it more comfortable, I think is really, really important because those families are struggling. And some of them are not always from even Leicester.
Yeah.
They're from so far away. I've spoken to parents in there when I've been in there, and they said, "Oh no, we're from Nottingham, or we're from the other side of Lincoln. wherever it might be, and you just feel for them because you think they know nobody here.
Yeah.
They don't even know where to get their food. There was only the canteen, and that in that era the canteen wasn't brilliant either, and they would struggle, and you know, my heart would sink and think, oh well, we've got it easy. We're only up the road. We're 5-10 minutes. We can go home, have a shower, you know, have something to eat, and come back.
Yeah.
But they can't.
No.
And it's really tough.
It's incredibly tough. I think back to a baby who was born with a heart condition, and her heart would stop at any moment. And mum was there with her, and dad also for chunks of time, but obviously he had to also go and work for 6 months. And I can't imagine the stress and fear that I'm maybe going through those parents' minds day and night, just being conscious of at any point things could take a turn for the worse. And being in that vicinity isn't easy. Being away is difficult, but how can we make that space a little bit more comfortable? That's it.
And those parents are living on a knife edge.
Yeah.
And they feel that they're on a knife edge. And I think it's a great cause, and I wish them really well, and I hope the listeners out there can support them tomorrow. The pledge day is tomorrow on Saturday, and it'll be for the Leicester Children's Hospital charity, and it's for the Children's Intensive Care Unit, and it's for the parents' facilities. Basically, the basics: a bed, just a comfortable area, so they can, you know, talk, pray, or whatever they might want to do, because that's all part of it, isn't it?
No, absolutely. And those private rooms would just be that space where they can just breathe at arm's length from the ward area.
And not only that, I just wanted to add this really, because apart from the parents, nobody else is really allowed in the intensive care unit. So the extended family, the grandparents or uncles or aunts or brothers, sisters, they're not allowed in there. And there's no area where they can sit apart from the corridors. And this gives them that extra space and the ability to have some kind of support as parents with them as well at the same time.
And I think that's so important because, again, it's a clinical environment where we have very vulnerable,
especially
very ill
children. Care is very, very clinical. It's just very, very critical in there.
Yeah. And again, it's about how do we create a space for people to then go to. Outside of that, one of the few places that someone might go is the multi-faith rooms, the prayer rooms. That might be somewhere. And I've been in on weekends when I've been called for an emergency, and I'll always pop in there just to sometimes have a prayer myself and just pause. And at times, often you'll see members of the community, sometimes, and I still remember I walked into the chapel and there was a gentleman there with his 2 young daughters, and he was distraught. And I just gently spoke with him and I engaged in a conversation, and he basically told me that Mum's dying upstairs. I don't know what to do. And he's come to this space. Those critical moments happen in our hospitals. It's we as a hospital will try our best to care for the person. There are lots of ways we might do that, but there are some areas where it's through charitable donations, through the Leicester Hospital's charity, people can support making things better. And I can't imagine the du'as and prayers that parent may feel in their heart for having that space. And every person who contributes towards that will be adding to that.
I think it's really important, really, to be honest, because having been in that space a few times in my lifetime, I think that whatever support you can, parents feel really lonely there.
Yeah.
Because they're in an environment that they're not used to, in a space that they can't sit there as well.
Yeah.
And it's a real difficult environment to be in. And whatever can make it easy, I think is really important. So I'm really glad that the Children's Hospital is really pushing for those facilities to be improved and raising the money to do that. We're running out of time. Really, thank you very much, Carter, for coming in. Really, really appreciate it. And just please thank all the rest of your team, your chaplaincy team, on our behalf, because you know we don't always get the chance to say thank you. On behalf of the patients of Leicester and Leicestershire, big thank you to them and all the staff that work at Leicester Hospitals.
Thank you so much, Zafar. It's a privilege and honour for us to serve in the NHS. And I know my whole team will wholeheartedly be alongside me. We're here for our communities. And if you come into hospital or your loved one is coming to a hospital and you need a chaplain, spiritual care, religious support, whatever it might be, ask for us. We are here to serve you. And so whatever we can do to serve you, prayers and du'as be accepted.